Hi, I'm Dr. Bojack from Landon Chiropractic, your posture doc. We're located in Stoneham, Mass, and our phone number is 781-GET-WELL, 781-438-9355. Again, remember our principle of our clinic is always for functional integrity. The power that made the body heals the body. Obviously, just to frame this up in regards to what's going on out there, there's a lot of challenges regarding your venues of how you're going to get your health, right? I think by now we all are pretty apprehensive about the CDC. We're really apprehensive about the FDA, and we're probably really apprehensive about some of these shots, right? So I don't think you can put any better trust than in your own body's power to heal itself, okay? And the same power that made the body heals the body. Remember that. It's always specific. It's always dynamic for your body, right? We have 1,500 actions going on in this machine every second of every day, okay? What controls those actions and activities is your specific individualized intelligence. And my intelligence is different than your intelligence, and it's always going to adapt and change according to what's going on, whether it's the weather, whether it's you're stressed out financially, whether it's you got a timeline in regards to your children's activities, whether you know what, you didn't sleep last night, or you only got one meal in and you usually have 3 meals. Whatever the case, again, adaptation is really the essence of balance, and balance is an inside job, not an outside job. Today we're going to talk about an exercise called the rocking chair, okay? So let's just back up a little bit. We're always addressing, or usually, right, we're addressing postural distortions, and postural distortions always come back to what? Mechanical dysfunctions, okay? Most of our mechanical dysfunctions are set up by negative patterns, okay? And I want you to understand, patterns are established through repetition, time and repetition, right? Time and repetition. So it's only through the time and repetition of you doing it day in and day out over 4 years, over 8 years, over 12 years that you establish these negative patterns, okay? Consequently, I want you to understand, in order to get rid of these patterns, these negative patterns, it's going to take time and repetitions, treatment or adjustments to reestablish positive patterns, okay? So what we're talking about as far as from a lateral dimension, remember, okay? Let's go this way, I'm sorry, okay? So if we look at the side picture of that spine, right, we should see that lateral cervical, okay? Again, remember, the strength of a straight line is derived by a number of curves squared plus 1. We have anywhere from 60 to 70% more tensile strength with a curve versus without a curve, right? With a curve, the stress is on these weight-bearing joints posterior to the back of your spine. If you run your hand down the back of your spine, you feel those projections. Those are your spinal processes, okay? And that's where all the stress should be when your head's back. Also remember, when your head's back and you have these curves, what's going on is that your stress, which is what? Physical, mental, emotional, and chemical stress, is dispersed over those curves. So when the curves are intact, the stress is being dissipated or spread out. When your curves are, you don't have a curve, or you have a military neck, now the curve's not spread out, it's going to be localized into one area. And with that, localization becomes mechanical dysfunction, and mechanical dysfunction always leads to what? Pain irritation, or actual functional, or actual dysfunction, okay? Which is irritation going out to your shoulders, irritation going into your sternum, right? Trouble breathing because of that pressure on your sternum. Again, remember, right, your head and your shoulders work together. Those are your sisters or your brothers, call them whatever you want. So when the head goes forward, what's going on? The shoulders are going to go forward. If the head goes back, the shoulders go back. Okay? So they reciprocate off of each other. Right? So, again, patterns. You have to understand patterns take time to get in there. Patterns take time to get out of there. If you want to correct structural integrity, it's going to take some time, some commitment, some effort. Okay, so in regards to these rocking chairs, also what we want is a lumbar lordosis or a curved lumbar also, right? So again, remember the cervical curve and the lumbar curves are what? Developmental curves. Okay, those are they're called developmental because you develop these curves over time. Versus your thoracic or your mid-back and your tailbone, those are primary curves, right? You're born with those. Remember? Fetal C position. Okay? So there's a reason why as we get older and we get more sedentary and we have lack of motion and mobility and we start reducing the mechanics of motion and the structure, we go back in, we go into a what? Fetal C position. So you might have some grandparents, some relatives, some aunts, some uncles are getting sedentary, they're getting less, they have less motion, mobility, and you can see, right, their posture is literally doing that, right? Their head's going forward, their shoulders going forward, and they're going into that fetal C. Okay? Again, remember, with that transition, okay, because they're losing the stability and strength to withstand what? Vertical gravity. So again, remember, we have physical, mental, emotional, chemical stress, and even those people are sitting in the Bahamas, right, on the beach watching this, you still have what? Vertical gravity pushing down there. Okay? And that vertical gravity is compensated by, through those curves, the curves give us that strength and stability. So the rocking chair exercise is going to address the neck curve and the low back curve, okay, to keep you in an upright postural position. I want to make this really specific, right? Most of you people out there who like to exercise, that's great, okay? I got nothing against that. Understand though, you cannot take a muscle through a full range of motion unless you have the mechanics. You have to have the range of motion, okay? So what I'm sharing with you is just like inflection of this lumbar spine, if we have mechanical dysfunction here and you only have about 10% range of motion, you're not going to work this lower spine all that well if you only have that 10%, 10 degrees range of motion when you're supposed to have 30. Okay? So again, I understand if you're fitness and you want to exercise or go to your strength and conditioning coach or your PT, I'm nothing against them. But doesn't it make sense that you first establish mechanics in the structure so you can take it through a full range of motion, so you can work the muscle like you need to work it according to their actual directions or instructions, whether that be core exercises or specific muscles addressing the problem. If we go into the mid-thoracic, okay, that's where people and females see that what? Buffalo hump or camel hump, right? It's right in your mid-thoracic. So as you're getting more and more sedentary, you're getting older in age and you're getting less motion, your head starts to go forward, and what you see is just that, the SPs or the spinous processes forming that actual lump or hump, okay, whether you call it a camel hump, buffalo hump, gargoyle hump, whatever you want to call it, okay? And as you can see it up here on the actual diagram, okay? Now, I'm telling you, a good majority of people that I see in our clinic have this anterior translation, okay, or those rounded shoulders, okay? And to prove it's a predominant problem, that's why you see all these braces, okay? So people ask me about wearing these braces to pull the shoulders back. That's fine and dandy, but I particularly don't care for them because the more you wear the brace, the more weaker this structure is going to get. Because now it's not doing it by itself, it's counting on that brace. So it's getting the musculature and the actual structural integrity is getting weaker and weaker and weaker. So when you pull it, you don't wear that brace, it's even going to get more mechanically dysfunction. Okay, so I don't recommend these braces. You pulling that pulls your shoulders back. Okay, and what you'll find as these shoulders go forward, that you'll find a lot of pulmonary problems or lung problems, right? Just because of the resistance going forward, the lungs start to get irritated. Even sometimes you'll have palpitations in your heart. Okay, it'll even challenge the heart because of all this resistance. Okay, and as far as shoulder irritations, I personally believe shoulder problems begin with postural distortions and mechanical dysfunctions. So because these shoulders rolling forward, you get impingement in these capsules, and the next thing you got is a frozen shoulder. Okay, you go to your surgical or your doctor, he refers you to an orthopedic. They do actual surgical intervention on this capsule, but do they ever fix this posture? No. So they do the surgical intervention, and you know what? The next thing you know, a year, 2 years, 3 years later, you got the same irritation in the shoulder again because they never address the problem. Okay, so our progression here, we're either growing or dying. Okay, so vertical gravity is going to get the best of us sooner or later if we don't maintain structural integrity and we don't maintain the strength and stability of the musculature and the ranges of motion. So upright position, right? And then you start seeing the rounded shoulders. Now shoulders start going forward so much. Balance is effective, and I'm saying that the balance, coordination, or agility is affected because you're using a cane. So now you have to have a third leg to add stability, right? And then you're going to a walker, so now those shoulders are really starting to go forward, and you're probably losing the availability for motion and mobility, and then you end up in a wheelchair, right? Nobody wants to see that, okay? But understand, this is the whole progression here. And this whole progression, or this particular challenge, is getting more and more predominant because what? We're moving less and less and less. And we're in these static sitting positions for long periods of time, whether we're on the computer, whether we're on the iPad, whether we're on the iPhone, and everybody's looking down, so they're just perpetuating these postures. Okay, so these rocking chairs, they're called them rocking chairs, and the premise is to raise your head up and your torso up, and to also raise up your legs. Okay, so now the head and the shoulders going back, you're probably going to double your range of motion up here in your upper thoracic. In your lower legs, these iliopsoas and your hip flexors, really small range of motion, probably 10 to 20 degrees down in your hips. Okay, so you're not really talking a whole lot of movement or motion. Okay, so, all right, you raise your head up and your shoulders up, and then you keep your legs straight and you raise your legs up. So what are we doing? We're arching the curve in your neck, and we're arching the curve in your low back. Okay, so again, I always tell my patients it's principle, right? If you understand the principle, then you can adapt to anything you're doing. So you can do this watching TV, right? Instead of watching TV sitting or laying on the couch with your head into your sternum with a poor postural position, if you're on your stomach, laying on your stomach and looking up, you're establishing that neck curve, and you're getting your torso back. Okay, and I don't even mind if you cheat, right? Meaning if you use your arms a little bit to push your head up, push your shoulders back and bring your head up a little bit more, and then come down, and then actively raise your head and your shoulders and push with your hands, and then come down. Okay, so head up, shoulders back. Try to come up as much as you can, keep your legs straight, and then you use your hands or your arms to assist you to provide a little more range of motion. Okay? And like I said, you can do this, again, watching TV. I don't even care if you put your hands underneath your chin to look up and watch your flat screens. But you guys all have flat screens. They're all huge screens nowadays. I mean, pretty easy to watch. Okay? But if you're on your stomach and you're got your head back and shoulders back, you're actually working a positive pattern versus a negative pattern, which is again what we're looking for. Positive patterns versus negative patterns. Okay? So relatively easy exercise. You can start off doing, 2 sets of a half a dozen, 6, and work yourself up to a dozen, 2 sets of a dozen, then maybe 3 sets of a dozen. Okay? And you'll start feeling this. But again, remember, right? This is supportive and an adjunct to your adjustments. Because if you're not getting adjustments, you're not going to have the range of motion in your neck, and you're not going to have the range of motion in your mid-back or your low back to provide a full range of motion to work the muscle fibers through a full range of motion. And then you're not working it efficiently, and you're not going to get a whole lot off of it. And I know time is valuable for most people nowadays. Everybody's got more than enough to do during the course of the day, more on their plate. So I'm trying to make it as efficient as possible if you're going to spend the time to do it. And if you're going to spend the time to do it, you might as well get something out of it and get a positive outcome. Okay? So again, that's just an actual adjunct to support your adjustments, to get that head back, to get your shoulders back, and to get that lumbar, lower lumbar back up over your center of gravity, which are your hips. Okay? So again, we want to be growing. We don't want to be dying. So you want to do, as we age, get mature, we want to just get more intelligent in regards to what we need to do in order to stay healthy, right? That's always the point, at least our point in our clinic. Okay? So again, thank you much for your time and your patience to watch us. I'd really appreciate it if you hit the subscribe button on this YouTube channel. You can check out our website, and we'd love to check. We would love to if you would give us an opportunity to check you out if you are having some of these dysfunctions or irritations or pain. Give us a call at our clinic, and we'll do a full workup to see exactly what's going on, put the cards on the table, explain it to you, and then it's up to you where you want to go from there. Thanks much. Remember, right, the power that made a body heals a body. There is no other. God bless. Enjoy.